Hi, welcome to the Physio Files, and we're talking today about workplace posture. I'm Graham Nelson, and this is Russell Visser, my colleague, and we're going to be demonstrating a couple of different postures that we consider ineffective or poor in the workplace. The reason why we're doing this is we see a lot of people with work-related problems, and mostly as a result of bad posture. So we'll give you an example of the two main postures that people struggle with and how to correct them. Okay, here we see posture number one that Russell has adopted, and it's basically a posture with his bottom well forward of the back of the chair. Okay, so he's creating a bit of a flexion strain on his lower back, and his hips are well forward. Not only that, his back is sitting in the chair where it should be, but his arms are fairly stretched out in front of him, and that creates a bit more strain on the neck as well, as his neck pushes forward to centralise things. Now, this is going to cause strain through the lower back here. It's going to load up a lot of the discs and the soft tissues in the lower back, and it's also going to cause strain across the shoulders. As you can see, his arms are quite extended, and that's going to lead to tension in the muscles up through the top of the shoulder and into the neck. So a posture like this can cause neck pain, it can cause shoulder pain, it can cause repetitive strain injury down into the arms, strain of the wrist as well, and elbow, and headaches. And it can also cause lower back pain and hip pain. And because this posture is kept for long periods of time, it can lead to other things developing as well that may be far removed from the area of areas that we're discussing now, such as knee pain, even leg pain. So to correct this posture, we're going to get Russell to slide his bottom back into the chair, right to the back of the chair there. Very good, Russ. And you can see already his posture has improved. Okay, so his back is well supported by the back of the chair. He's still got his shoulders, the back of his shoulders in contact with the back of the chair as well, which is great. And now, if we stretch your arms out, Russ, okay, he's still a little bit far away from his keyboard, so I'll just get you to slide in a little bit. Okay, and his arms are in a better position there where they're not stretched, his elbows are comfortably bent, and his spinal posture is in good alignment. Okay, this is bad posture number two, and we can see here that Russell has got his bottom back in the seat, which is what we talked about, which is good, but his shoulders and most of his back is well away from the seat. Not only that, he is peering forward, he's very close to the screen, and the top of his neck is extended so that these small muscles at the top of the neck and the base of the skull are being shortened. So that creates tension here. That's going to lead to things like headache, neck pain. His shoulders are also hunched, so that's going to cause strain through the neck and possibly lead to pain down the arms, as well as back and lower back pain. Okay, so people might adopt this posture if they're having problems with their eyesight and they need to get closer to the screen. So one thing we recommend to our patients if they're having some difficulty at work setting things up correctly is just to get their eyes tested to make sure they've got that's covered adequately. So the other reason is that people playing games might get into this posture where they're really focused and intent, or straining to see some smaller print on the screen. The other reason is if the desk is too low, that can also cause this sort of posture. To correct this posture, we'll just ask Russell to sit back in the chair, and so that his back is supported by the backrest in the chair. And ideally that should go up to about the shoulder blade height. Now from there, again, he still has his arms stretched a little bit too much, so we'll get him to move in a bit closer. And that way his arms are comfortably bent, his shoulder posture is better, and I'll just get you, Russell, just to nod your chin down, just like you're saying a yes movement, Yep, and that's the posture you want to keep with the neck, so that the top of the neck and the base of the skull is extended or stretched. Okay, so it's not being stiffened and becoming tight. And he can see the screen in front of him. Ideally the screen should be at about eye level, so that he doesn't have to look down too much. It can be slightly lower than eye level, and then he can just gaze down as long as he doesn't look down with his neck. And that's fairly good posture. You can see that his hips and shoulder are in good alignment there. He has a natural curve in his lumbar spine and a curve going the opposite way in the thoracic spine, and those curves are being supported by the chair, and his neck is in a good position with some elongation through the back of the neck there. So if you're still having problems with your posture at work or setting things up adequately, there's a couple of things you can do. One, you can go to our website, nwpg.com.au. There's a report on there of how to set up your workstation. There's 10 important points to consider, so you can have a look at that report. If you're still having problems and you feel that it's difficult for you to maintain posture, that may be related to muscle tension, joint stiffness, muscle weakness, or other imbalances that exist in your musculoskeletal system. So I'd probably suggest you come in and get us to have a look at it, have an assessment. We can see what things need to change for you to maintain adequate posture. You can also bring in a photo of your workstation. So for example, get someone to take a picture of you on your phone while you're at your desk, and we can analyse that and see what we need to change. And I think generally we find that there's a lot of problems that do occur from poor posture. A lot of people are unaware that they have poor posture at their workstation, and as mentioned, this leads to other issues down the track. So I think it's good to nip these things in the bud, have an assessment, and get the things sorted out that need to be. So if you're having problems with your posture at work, come in and see us. A lot of these things can be fairly subtle and fairly small, and we can assess them and treat them fairly quickly to get a good result in a short period of time. So come and see us at Northwest Physiotherapy Group. Give us a call, 9370 5654, or you can book an appointment through the website. Thanks very much.